Hello, everyone, and welcome to today's webinar, Rehab Agency Update, Conditions of Participation, Infection Control, and CMS Mandates. My name is Sabrina McCarley, and I will be your moderator for today. We are very excited today to have Nancy Beckley, Laura Riddell, Monda Shaver, and Dick Hillyer with us today to discuss this very important topic, as they are our subject matter experts. Before I turn it over to them, I just want to remind all attendees that you are on mute. A couple of things about the handouts. The handout, there was a link that was sent in a reminder email about an hour ago. This session is also being recorded. For the recording, I wanted to clarify that they will be available by the end of the day of Monday. And what will happen is you'll actually receive an email from Zoom, and that will contain a link. It will also be available on the NARA members portal. If you should have any technical issues during today's webinar, we please ask that you type those into the chat. You will also see that Christy has provided everybody a link right there as well for a link to the slides if you did not receive them. She can help with any technical issues. And if you have any questions for our speakers, we please ask that you type those into the Q&A, as that way we can monitor them. And also, if we do not get to all the questions by the end of today's webinar, we can gather those and send those out as well. So with that, I will turn it over to you, Nancy.
All righty, thank you.
Actually, I'm going to jump in, Nancy, if you don't mind. I want to say thanks to Sabrina and thanks to everybody for joining us today. We have a great webinar plan that's filled with information that everyone who is responsible for rehab agency compliance cannot afford to miss. We're going to be covering the new CMS mandate and the associated Quad A accreditation standards. This slide just represents a simple reminder that this presentation does not constitute legal advice or consulting advice for many of us. Remember to always go to your source documents or seek counsel for your specific location and circumstances. Our disclaimer. Again, I want to just say good morning and thank you to everyone for being here. I'm Laura Riddell. I'm the Chief Compliance Officer for Mountain Land Rehabilitation. Joining us today, we have an expert panel that includes Monda Shaver with Quad A. She's the Chief Regulatory Affairs Officer, Dick Hillyer, who is a Quad A board member, and Nancy Beckley of Nancy Beckley and Associates. Let me start out with a formal thank you to our presenters. We really appreciate the time that you've put into preparing the excellent and informative presentation for our NARA members. Nancy and I had originally planned to include the provider perspective in this webinar in preparation for the implementation of the mandate, both for state and Quad A surveys. However, given the significant compliance obligations, we shifted to afford Dick and Monda the maximum amount of time to review the required policies, procedures, and processes that we're going to want to be really aware of. It's NARA's intention that we're going to follow up in 2 to 3 months with a webinar that is going to talk about what's happening in the field since the surveys have started, again, with hopes that we'll have both Quad A and state survey experiences. We're hoping that by then we'll have a bit more perspective from CMS as far as what their expectations and processes are. You're going to have an opportunity to hear from each of our panelists a bit later in our webinar, but for now, I'm going to turn this over to Nancy to take it away.
Okay, thanks, Laura. Here we are again with another great rehab agency presentation. And Dick, you're back with us again after many, many times doing this. So we all know for rehab agencies, there's 12 conditions of participation. We have interpretive guidelines from CMS. We have the associated accreditation standards from Quad A. They all are informing our rehab agencies as to the required policies, procedures, and processes. There are a few things that may be of interest. For example, CORFs have very similar standards that they have to meet. However, for the CMS mandate standard, you would take a look at a different CMS supplement that's applicable to CORFs. But if you're a CORF and listening in today, much of this information will be very helpful to you in terms of getting ready for the mandate. Couple of quick fun facts. CMS database as of January 2022 shows 2,038 rehab agencies with about 7,300 77 since the start of the program. We're now down to 159 CORFs and orphan program. Just thought you'd like to know a few tidbits on that. So here are the 12 conditions of participation, which most of us are fairly familiar with. The CMS update for rehab agencies is in the infection control condition. They've added a new standard F. Quad A is going to go through how this update fits within their accreditation standards because it syncs just a little bit differently. So with that being said, I'm really excited to turn the presentation over to Dick and Monda. I'll be your slide controller as you get going. So welcome, Dick and Monda.
Good morning. My name is Dick Hillyer. I'm a PT by background. I've been a surveyor with Quad A for now 13 and a half years, much because Nancy organized with Quad A's assistance and NARA's assistance organized the first surveyor class, which we appreciate. One of the things that I think would be appropriate for us to discuss as we go in, Nancy mentioned that there are several attachments to the QSO 29-09 statement about the supplement for the standards. And attachment J is listed at the bottom of that particular sheet for OPTs. And since many of the people in this group also have a foot in the skilled nursing world, attachment G, as in golf, would be appropriate for them. And if you're also doing long-term care HHA, home health is G as in golf. LTCs and SNFs are attachment A, and there are attachments for hospitals and CORFs. But as Nancy said, the content is very, very much consistent. So we recognize that there is a breadth and diversity in this audience, from mainly clinicians to administrators and corporate executives. There are people with interests and activities in OPT as well as SNFs and home health. There are people with interests who are licensed assistants with bachelor's degrees and are administrators. There are full-time multi-site administrators. There are entrepreneurs and owners, and there are managers, leadership, and executives of large organizations. So we appreciate everybody paying attention to it. There was a time when you pretty much could operate a clean practice and you'd be meeting almost all the standards. Now there's a lot that's fluid, and different people bring different sets of experience and perspectives to this group. So it's always a good idea. And if Christy were here, I'd say it's a little bit of a sales pitch. Go to the NARA meetings. In the spring, they're in Washington. It's about regulatory affairs. In the fall, they're elsewhere, and it's about professional and business activities. So it's good to be there. We're going to endeavor today, and I'm very thrilled to have Ms. Monda Shaver with us. She's a nurse. She's got a master's degree in data informatics, and she's got a tremendous amount of experience, a couple of decades wrestling with the compliance side of the business. So from my perspective, she's one of the smartest people in the room. So please be sure that we know significant additional on-site work and time is going to be spent in all of us trying to comply and document. Our surveyors are there pretty much like photographers to just document how well a rehab agency is complying. We are not the government. So be aware that we're there. We know it's going to be a lot of work. We're going to review procedures and policies, documentation related to the new standards. We're going to be interviewing and observing staff, which some people in the past have felt just hand us a policy manual and some charts, and we just review them in a different room and go away. CMS expects us to observe patient care and to interview staff and patients. So it will take extra time. Somebody asked me recently, a well-prepared location for a survey, if I go, I count on 6 hours minimum, and I've had them go 9. And if I have multiple sites with 2 or 3 days, I always schedule an extra day at the end, just in case, because things happen. So I also, just at the beginning, want to tell you, when I show up for a survey, and I hope that our other surveyors too, I always tell people, number one, this is an open book quiz. All the questions and answers have been provided. The standards, which now look a little bit like this, have been stated clearly. And there is interpretive guidelines from CMS in their state operations manuals. So you definitely need to grab your set of standards and the operation manuals. You'll see that basically the standards are almost plagiarized verbatim from the CMS state operation manuals. So our job basically is to be, as I said, the photographer, the person who goes and looks. So at the end of this period of time, we hope that you, every one of you, will understand the new staff vaccination requirements and their implications, that you'll understand the survey process for the new requirements, and that you'll review the tips and tricks to prepare for the survey. And we're going to endeavor to present the facts as we know them to the entire industry. Please be aware that we know about that extra time. So it's an open book test. We're not there to do gotcha. And ultimately, we work for you. You pay the quad A, and they pay the surveyor. So our role is sort of to hold the standards in one hand and a camera in the other. So today our role is to explain what has been decided elsewhere and is in the process of being decided. So we'll go to those introduction slides that Nancy has, and we'll raise a question. Where do emergency regulations come from? Notice we're not going to really be talking about neurons and myofibrils much today. We're going to talk about the things that we need to put together so that our skilled clinicians can go help their communities. So where do the regulations come from? Obviously, in the case of this emergency, the office of the president, the executive office, declared an emergency. They provide directives because the Department of Health and Human Services is part of the executive branch of government. Health and Human Services hands down its directives to the CMS, the Centers for Medicare and Medicaid Services, and CMS then transmits them down to you, the provider, and there are two kinds of groups who inspect you. The state agencies, nicknamed SA, and that's the various state departments of health. And for OPT purposes, the accreditation organization, and there's one, and that is AAAASF. So on Thursday, November 4th, CMS published a special edition of MLM Connects to inform the nation that the Biden-Harris administration is requiring COVID-19 vaccination of eligible staff at healthcare facilities that participate in the Medicare program. So how big an expansion is that? The national requirement protects patients at nearly 76,000 providers and covers more than 17 million healthcare workers, including us. So statistics on COVID-19 are updated almost daily, not just how many caught the disease, went to the hospital, or have demised, but also where do we think it's going? And as this may be approaching the levels of what we find in winter flu, please be aware that this or other rules may be changed on short notice at the discretion of the appropriate governmental officials. Okay, can we go to the next slide, please? Okay, the new set of standards. Many of you are used to a set of standards which came from our previous books that had the 100 series at 200, 300, up through 1200, and then 1600 was emergency preparedness. We now have a different set of numbering that has been used in order to standardize our standards. And it's presented in a horizontal format. It is available at Quad A's website right now. And and obviously is available to you to do what you want. Why is that really critical? Because these new standards are going to be, new statements of standards are going to be effective with surveys that take place on or after March 1st, which is what, a week and a half away. So when we look at the standard that says facilities must develop and implement the new policies and procedures to ensure that all staff are fully vaccinated for COVID-19. One little hint that I learned from Ms. Shavers is that the people at the Medicare office agonize over the use of each word. If they say something must be done, they have actually got together and considered whether they could say it may be done. And must be done is an official decision that's been made way above our pay grade. So the words matter. This is a mandate. Further, you're going to hear some terms in this discussion that are a little bit different from what you're used to. And you're going to hear some that are stronger. So where this comes and says the organization must, it's not optional. It must develop and implement. It's not enough to have thought it through with 3 of the best minds in your organization. It has to be in writing, it has to act, and then it has to be actually implemented. So there's policies and procedures, and they have to be implemented, which means usually the surveyor is going to say, may I see documentation of it? Which means not just do you have to have made it official, you have to have actually done it, be able to prove it. Very similar to what you have to do to prove that you've been cleaning your hot pack machine according to the manufacturer's instructions, which happen to be emptied and cleaned every 2 weeks, by the way. So the national requirement protects patients at all these people. Statistics are there. A policy is a set of ideas defined, or a plan of what you're going to do in a given situation. Usually what we're looking for, if there's a policy, we want to see that it's been agreed officially and usually that it's in writing. So what does fully vaccinated mean? And for the purposes of this section, staff are considered fully vaccinated if it's been 2 weeks after they completed a primary vaccination series for COVID-19, which is the topic under discussion. It's not talking about influenza A or AIDS or something else. What is a primary vaccination series? The completion of a series is defined as the administration of a single dose vaccine or the administration of all required doses of a multi-dose vaccine. And may we go to the next slide, please. So the policies and procedures, to whom must they apply? To whom? Facility employees, licensed practitioners, students, trainers, and trainees, and volunteers, and individuals who provide care, treatment, or other services, including clerical. So we'll go to the next slide. Okay, J6 and J7. There are some people who are not required to be included in the policies and procedures. So when I write down all employees, I have to put an asterisk up there and say, so some may not. Telehealth staff who are outside the facility, who don't have direct contact with patients and other staff. Support service staff, people who don't have direct contact with patients and staff. Now, if you have a housekeeping organization, they may have required their employees, but this particular regulation doesn't require your people who come in after hours to clean the building necessarily. Some other exceptions do exist, and we'll discuss these a little bit later in the presentation about exemptions and delays, etc. So we'll go to the next slide. So there are minimum requirements for policies and procedures. Now, this whole discussion starts with CMS saying you have to develop policies and procedures. It doesn't start with you got to get everybody vaccinated and then do policies and procedures. You do the policies and procedures, which begin with make sure everybody gets vaccinated, 100%. And it's ensure that everybody's been vaccinated for COVID-19 or have obtained an appropriate health or religious related exemption. That's critical. So there are people who think, oh, well, now that you've told us about this, maybe then we can begin doing it and we'll see who we have in the organization. Medicare published this in November. It was debated, it went through the courts, there were a couple decisions, but now it has been published in January. And like some of us, Nancy's one of those people who I think gets up in the morning and reads the Federal Register for implications to us. January, they said, okay, this is now 30 days after the thing has been published. And various states will have different dates. And Ms. Shaver will talk about that in a little bit. So we have developed policies and procedures. Everybody gets vaccinated, and the minimums are going to be how your policies and procedures are laid out, ensuring everybody's there. And you have to show a process that shows a naturally recognized infection control guidelines are followed. Again, when it comes to this level, I mean, jokingly, we used to say it's a federal case. It's not a question of what the best minds in our town got together and decided in a seminar. It's been decided. And therefore, they're saying, if you're going to say that you have infection control in your clinic, you need to be using nationally accepted and nationally recognized guidelines. So let's go ahead and move to the next slide, please. Minimum requirements for policies and procedures. So there has to be, and here come another set of words. And as I said before, the words really matter because that's all the surveyor really has to go on. They can have a cup of coffee and talk about how they feel about the weather, but when it comes time for the survey, they're looking and say, okay, may I see, please? And those who know me have said I always comment to say, that's the most common statement during a survey. May I see it, please? So the minimum requirements for your policies and procedures, there has to be a process. You got to have a policy, and then you got to demonstrate the action, the procedure that has a process whereby you're going to track and securely document. 2 items again. The vaccination status for everyone, securely documented. You have to have the process to track and securely document status of any staff who have obtained any boosters. So there's the basic sets, the booster sets, process for any staff to, what's the process? Not just, oh, Sandy asked for. What's the process that you decided ahead of time is the process for requesting an exemption. And then a process for tracking and securely documenting all the information that the requestor has given. It's important to recognize that surveying for compliance with the standards includes reviewing the dates when the elements are addressed. If there was something that we are in a 30-day, now we're in the 30 to 60-day period, and if today is say, where are we? We're just past the 30. So let's say today's 34, 35, if we're in that state. An example would be renewal survey in April. And the surveyor comes in and is expected to retrospectively review whether or not you were doing this on the 18th of February and how you were doing on the 15th of January. This is a little bit, one reason I think that some of us jumped at the idea to communicate this is because it's so important and the time flies. After they announced the emergency preparedness standards in 2016, they gave 1 year to implement them. And we started surveying in the middle of November the following year, and we discovered agencies who still didn't even know that they existed, but they're accountable to have been doing it during the past year. So This is us trying to help people understand that this has all been developed. So each of these processes that says, how are you doing as of the 30th day, the 60th day, the 90th day, is all subject to the mandate. So each of the process needs to be written and spelled out in detail. May we go ahead to the next slide, please. J15, the process for ensuring that all documentation confirming recognized clinical contraindications, vaccines, support staff, has been signed and dated by a licensed practitioner. And there are standards there. You're not allowed to sign your own thing. I'm not allowed to sign my handicap parking sticker. And you have to be acting within your respective scope of practice. So Dick Hillyer, the PT, may not certify that someone else is allergic to one of the COVID vaccines. May we move ahead? Thank you. So there are minimum requirements for policies and procedures. Again, when we're talking about the request for medical exemptions, it must include the specific authorized or licensed COVID-19 vaccines. So what's the history of a severe allergic reaction that my friend Sandy may have after a previous dose? Is it documented? And next, a history of a known diagnosed allergy to a component of that vaccine. And then, has there been a thrombosis with thrombocytopenia syndrome, TTS, following receipt of a previous Janssen COVID-19 vaccine? So this is more than simply saying, get your doctor to give us a receipt. You may get the picture by now that the regulators above us who really want to make things tight are doing so. So there are a number of other precautions for the vaccines were found on the CDC website, and you can find links on the resources slide at the end of the presentation. So may we go to the next slide, please? So minimum requirements for policies and procedures continue. Medical exemption documentation has to include, again, this. Okay, delayed vaccination documentation may also go. There are some people who can't get a vaccine now, and we're not saying they're evil people, we're just saying we have to document it. If there's a delayed vaccination because of an acute illness secondary to COVID-19 or someone who received monoclonal antibodies, then individuals who receive convalescent plasma, all those may require a delayed vaccination, which is fine. You need to have a policy, you need to have a procedure, it needs to be tracked, and you need to document that you've done all that. We'll go to the next slide, please. J18. Okay, I got to catch up. I'm using a different page. I apologize for that. Okay, J18, minimum requirements for policies and procedures. A final thing, just like a good business plan always requires at the end that you have implemented controls and processes for cessation, contingency plans for everybody who are not fully vaccinated for COVID-19, recognizing that there may be people who are not vaccinated because of the things we discussed, which is either they have a medical exemption, which has been documented, or they're delayed at the time. And we're not talking too much about the religious exemption. There is one, there's a reference in the resources at the end of the presentation that people are going to look at to see whether or not one of those is appropriate. So the plans have to include actions that the staff would take when they have indicated that they won't get vaccinated and they don't qualify for exemption. So your policies have to say, so what are you going to do? They should also address staff who are not fully vaccinated due to an exemption or a delay. And the facility should prioritize contingency plans for those staff who have obtained no doses of any vaccine that have received a single dose of a multi-dose vaccine. Now, in the interpretive guidelines or the guidance, CMS says these plans should include a deadline for staff to obtain their first dose, period. They should also indicate the activity that your agency will take if the deadline's not met, such as actively seeking replacement staff through advertising or obtaining temporary vaccination certificate staff until permanent vaccination replacements can be found. So then we get, next slide, please. Thank you. The survey process. So during the entrance conference, now compliance will be assessed, as I said, through observation, interview, and record review. I've gone on surveys where people call their boss and say, the state's here. We're not the state. You know pretty much within 30 days when you're going to get surveyed by our organization. If you're one of our clients, it's going to be every 3 years, and our staff starts communicating with you 6 months early so that you can be ready for it. So compliance will be assessed through observation, interview, and record review. During the entrance conference, the surveyor will request to see all of these policies and procedures related to staff COVID-19, as well as all the others. So, so how are we going to assess compliance? Well, for those who are accredited by us, we can address that, and it's pretty set across the country. If you're not accredited, but you're certified, and we're happy to do that as an OPT, under a state Department of Health, then they can vary according to the states. As always, in an OPT survey, compliance will be assessed through us actually saying that we saw it. So anticipate and prepare to produce all policies and procedures, including the new ones related to COVID, as well as complete personnel files. Used to be, we would look at personnel files and we would say, okay, you've got a license, you've got a diploma, maybe you've got a CV in there. These days, as you go through the standards, you'll see that we don't have a standard about CPR, but Medicare is looking for CPR certification. They, you know, so there's a whole bunch of things, and we may come up with a list of what we think is wise to have in a thorough personnel file. But we'll also want to see vendor contracts, leases, and of course, the annual fire marshal and building inspector certification that the premises meet the local fire and building codes. So let's go to the next slide. Okay, now our surveyor will request a list of staff and their vaccination status, and it has to include, and it had to include 2 weeks ago and 3 weeks ago, the percentage of unvaccinated staff, because they want to know, are you 100% vaccinated? Or are you 95% vaccinated? 60%, 40%, 80%, all those numbers matter and have implications. So the percentage of unvaccinated, excluding the people with exemptions. What's the identification? Who are they if they're vaccinated? Identification of anybody remaining unvaccinated due to medical or religious exemptions. So keep in mind the list of all staff has to mean also any vendors or contractors who would interact with patients or staff. If you use a manpower contractor and we used to talk about 1099 employees or a staffing agency, they qualify. If they're doing clinical things, it matters. So these are there are considerations made for newly hired staff, but the expectation is that the staff person will have at least the first dose and will be working on it. May we go to the next slide, please? So in the survey process, surveyors will verify all required components of policies. So back then when it said there has to be policies and procedures, and in those policies and procedures, it has to have a process for this and a process for that and a process for the other. Surveyors will be saying, may I see the process, please, for this? And if it says it needs to be documented or tracked, may I see how you've documented or tracked it, please? So we're there to be thorough. Surveyors will review any contingency plans and all required components that you've had to initiate. Whatever you're doing, to mitigate the spread, which can include, I don't know of any OPTs I've known of that were running COVID clinics. But there's a whole lot of possibility. You know, have we reassigned any unvaccinated staff to keep them away from spreading the COVID? Shall we go to number 16, please? Thank you. Surveyors will select a sample of staff, which will include Peter, Paul, and Mary, all staff with medical exemptions, direct care staff, contracted staff, direct care staff with an exemption, and vaccinated staff. Who are they? For every one of them, there's a whole set of standards. Review the records to verify the vaccination. An acceptable form would be whatever certification is there, a record card, a legible photo of the card, documentation of vaccination from a healthcare provider, state immunization systems record. For everybody who is unvaccinated, then we want to see if we may review their records, determine if they've been educated and offered vaccination, interview staff and ask if they plan to get vaccinated, if they have declined to get vaccinated, if they have medical contraindications. What about an exemption if it's appropriate, and look for documentation on that. Our surveyor will request to see employee record of staff education. So now there's another thing that has to be in the education forms of the OPT of the policy. So for everybody identified as unvaccinated, then we need to find out if there's contraindications, all the documentations. In any instance of a discrepancy, the surveyor will conduct follow-up interviews with staff. So having done that about the survey process, I will yield to my esteemed colleague, Ms. Shaver, and let her proceed from there. Thank you very much.
Thank you, Dr. Hillyer. So continuing on with the fun topic here, we're going to talk about how compliance will be determined and then the level of deficiency that will be applied and how that's figured. There are 3 levels of citation that are possible. Immediate jeopardy, or what we call IJ, which is the most severe deficiency that can be cited to a CMS participating facility, and one that I'm sure probably not too many OPTs have ever encountered. So some new territory here. And then we also have condition level and standard level, which are more common. So this is the first time actually that I'm aware of that CMS has actually given us a formula to use to determine the level of compliance that should be cited. Here you can see that if the vaccination rate is 60% or below, that would actually be considered an immediate jeopardy. Or the alternate criteria is if a facility is below 100% compliance rate and the surveyor observes staff not following infection control processes, and there are 1 or more components in the policies and procedures that have not been developed or implemented. Okay, we can go to the next slide. Conditional level citations are the most severe citation after immediate jeopardy. And CMS, again, has given us some specific criteria for assessing when a condition level deficiency would have to be cited. So the first criteria, which can stand on its own without anything else being out of compliance, is if the vaccination rate is between 61% and 79%. And again, the alternate criteria is if the vaccination rate is below 100% and there is a missing component of the required policies and procedures, or the policies have not been fully implemented. With both of the IJ and the condition level findings, of course, there would be a follow-up survey process and plan of correction and all of that. The big difference with immediate jeopardy and then the condition level is the timeline for those follow-up surveys to take place. So if you were actually cited for an immediate jeopardy, that follow-up survey would be taking place within 23 days of your original survey, whereas the condition level would be within the 45-day time frame that we normally see. Next slide. So here, oh, I'm sorry, the standard level. Just to mention the standard level again, there's criteria, and this is the lowest level of citation that a facility could get with being out of compliance with the set of rules. Vaccination rate would be below 100%, and all new staff have received at least one dose, and there's one or more components of your policies and procedures that haven't been developed or implemented, or the vaccination rate is below 100%, but the facility is making good faith efforts towards compliance. Okay, now we can go to the next slide. So this one, just the actual slide is just kind of a picture of these different implementation and enforcement dates that Dr. Hillyer's referred to earlier in his portion of the presentation. How these came about is that CMS had published a series of memos since November related to the guidance on the vaccination standards, including the implementation and enforcement. And the memos essentially, like he alluded to, contain the same information, but released on different dates. And this point is significant because the implementation dates within these memos state that compliance with the standards is expected within 30 days from the date that the specific memo was published. So the first memo was published on December 28th, 2021. And this means that surveying for compliance would start January 27th, 2022. This original memo applied to only about half of the states. There were 24 states that had brought a lawsuit against the regulations that made its way up to the Supreme Court. And now Texas was part of the was not part of this lawsuit, excuse me. And it had independently filed a similar lawsuit against the regulations. So we had half of the country required to demonstrate compliance with the standards by January 27th, 2022. Meanwhile, the Supreme Court made a ruling which lifted the injunction that had been put in place on the remaining 24 states. And CMS's response to this was to publish another memo with the same guidance, but with a different implementation and enforcement deadline than what the first group of states had. So this group of states needed to be compliant 30 days from January 14th, 2022, which was the date the memo was published, and would have to be compliant with the regulations by February 13th, 2022. So that just left Texas standing alone. And about a week after or so, after the Supreme Court ruling on the first injunction, Texas ended up dropping their lawsuit, which in turn lifted the injunction against the implementation of the standards for Texas. And so this gave us, once CMS published a specific memo for Texas, it gave us our third implementation and enforcement date. So now that we kind of have a background on the implementation dates and how they were established, I wanted to just talk briefly about why this would be important. And the bottom line is enforcement measures. These memos outline specific dates, 30, 60, and 90 days from the date of each memo related to thresholds of noncompliance in the application of additional enforcement actions that CMS may take against a facility for noncompliance. The only real enforcement action for OPTs would be termination from the Medicare program. Other programs, have additional enforcement actions that could be taken, like the civil monetary penalties and such, but that doesn't apply to OPTs. So in looking at the memos in the 3 compliance dates, CMS is stating that between 30 and 60 days after implementation of the regulations, anything less than 100% is a deficiency across the board. However, the additional enforcement action would not be in play if a facility's compliance rate was 80% or above. And then they state that between 60 and 90 days after implementation, anything less than 100% is still a deficiency. However, the additional enforcement action would not be in play if a facility's compliance rate is 90% or above. And then, of course, after 90 days, all enforcement actions are in play. And I don't want to let this scare you because, you know, CMS typically does not automatically terminate a facility from the Medicare program. They really do try to work with facilities to come back into compliance. So there's been a lot of questions and, you know, talk about these dates, what they mean and everything. So we thought it was important to kind of go through what they mean, how they were derived, and to let you know as well that Quad ASF has created, it's pictured here in the slide, a state list to identify the various phases depending on what state your facility would be in. Next slide. So talking about the plan of correction, all of the normal requirements for an acceptable plan of correction will still apply to these standards. Clearing the citation here is focused on the vaccination rate and offers a couple of different ways in which an OPT can come back into compliance. And those are that the OPT has met the requirement for staff fully vaccinated, either by staff obtaining additional doses or replacing unvaccinated staff with vaccinated staff, or the combined number of staff that are vaccinated meet the requirement. Staff has received at least one dose and must also have their second dose scheduled. Of course, addressing any other components of the citations that may have been in your deficiency, such as missing pieces of your policies and procedures, any infection control breaches that may have been observed during the survey, those would also need to be incorporated into your plan of correction. Next slide. Substantial compliance with citation remains at the standard level. Again, all elements of an acceptable plan of correction would be required. However, in order to clear an IJ or immediate jeopardy or a condition level finding, the OPT can provide evidence that progress to improve its vaccination rate is being made. So here CMS states that the OPT's citation can be lowered to a standard level deficiency as long as it can provide evidence of the previously unvaccinated staff which triggered the IJ or condition level deficiency have now received their first dose of vaccine, and the remainder of the unvaccinated staff are scheduled for their first dose. And now again, I'm going to reiterate what Dr. Hillyer said earlier too. If a staff person is unvaccinated, but they have an approved exemption or a reason for delay, they are not included in these rates as far as being deemed unvaccinated, just unwilling to be vaccinated. So that's really what we're talking about here. Next slide. So components of a POC and actions required for removal of IJ. Of course, correct any gaps in your facility's policies and procedures. Implementation of the facility's contingency plan, including establishing deadlines for unvaccinated staff to have received their first dose of vaccine. And implementation of additional precautions to mitigate the spread of COVID-19 by your unvaccinated staff. Next slide. I'll just touch on this briefly, but CMS mentions throughout its guidance about good faith effort related to these standards. And like with determining the level of citation, they give us some pretty strict guidelines to use in order to grant some leniency during the compliance determination phase of the survey. And that includes and this is all prior to the survey starting. So if the OPT has no or has limited access to vaccine and it can document that they've made attempts to attain the vaccine. And then secondly, if the OPT can provide us evidence that aggressive steps have been taken to ensure all staff are vaccinated. such as advertising for new staff or hosting vaccine clinics, etc. And then survey tips. We have several things listed here. Ensure policies and procedures address all requirements, and it relates to the next one is please use the standards and the guidance as your checklist to make sure you're prepared. Make sure that you're tracking and documenting everything, and it's secure and it demonstrates compliance. And then we do suggest that it's not a requirement, it's just a suggestion to help alleviate stress on the day of the survey would be to have these specific policies and procedures and all of your documentation in a central location where you can get your hands on it easily when this part of the survey takes place. And then this next survey tip is true for any survey, is use the tools you already have. If you have Outlook or Gmail, calendar, those types of things, you might want to set reminders to follow up, on staff who may have had a temporary delay, or those who, are due for their second dose. Things, things that could trigger your memory to go back and follow up on. And as we move into the next portion of the presentation, the Q&A portion, I did want to say that we're continuing to meet with CMS and state agencies on these, the implementation of these standards. And so we'll be happy to answer all of the questions we can today, but keep in mind that even the states and everyone there's still a lot of unknowns. So if there's questions we can't answer directly today, we'd be happy to take those back to CMS and see if we can't get clarification or answers for you. So thank you. Nancy.
Alrighty. Thank you, Monda and Dick. This was absolutely fantastic. Laura and I were just texting back and forth. We're stunned at the lack of questions and wondering if everybody's stunned by listening to all the requirements. The first question that I want to address, and I'm going to ask both Dick to address it and Laura to address it. It says the information provides details on the specifics of a medical exemption. Is there information available on specific requirements for religious exemptions? And Dick, I'm going to ask you to address that quickly. And then Laura, maybe you can address at an organization, what would an organization need to do to address religious exemptions? Dick?
Yes, thank you, Nancy. I did double check that actually in the document, the QSO 22-09 for all. It only said that they would pass on religious exemptions. But in discussing with Ms. Shaver, we knew that there would be some, and the CMS folks referred us to the EEOC's policy on non-discrimination. And we have that as a reference in those resources on the last page. And depending, if you're looking at them, depending on whether you're looking at this or if someone is actually typing, you can either do a control and a click, or you click on it and you'll go to the entire EEOC discussion of what constitutes a religious viewpoint, what constitutes a religion. And they will give examples of areas that most of us would not have thought of, such as it's possible that there could be a religion that only one person in the universe subscribes to. And they can use definitions of whether this is a principle that relates to people's concept of life in general, of the meaning of life, and their future and all that. And if they have a conviction, not a preference, always a big deal, to move in a certain direction, maybe they can get a religious exemption passed. I am familiar personally. I moved to Florida almost 23 years ago because a young woman had her third child and she raised her children. She had gotten a job at that hospital system straight out of her graduate program in PT. So now she's been there 34 years. She's raised 3 children, put them all through school. They're fine people and all that. And she was faced with having to lose her job over the mandate. And she appealed for a religious exemption based on a fact that she had about the source of the materials for the thing. Anyway, the hospital system had a policy. You got to have a policy in writing. And the hospital system had a policy. They treated her fairly and equally according to their policy, not according to their preferences. And she did receive an exemption. So that organization has not lost the institutional knowledge of that person. So anyway, there's a lot to it. It's got to not be a preference. It's got to be a conviction, and you got to be able to document it. Some of those things. I'll yield to whoever would like to address it. Laura, how about
Laura,
you?
yeah, because Laura, give us an example of what an organization might do as you're involved in that fashion.
Thanks. The timing is actually quite perfect with this because I was in a meeting this morning with our managers, and they were challenging our HR team and saying, who are you to, and how do you decide that somebody gets or doesn't get a religious exemption? Especially medical is a little bit clearer and cleaner. But following, as Dick said, the EEOC guidance, there's 2 things that we're paying attention to first and foremost, and that's, is the religious exemption request based on a religious belief? And if so, is the religious belief sincerely held? And what we've developed at Mountain Land is a set of questions that an individual who's submitting it has to complete a questionnaire and truly complete the questionnaire. It's not an easily done exemption to receive, because you do have to sincerely share your personal beliefs and opinions. It's not what we don't want to see is a brand new religious belief that you've acquired since January 14th, 2022. We want to have you show some evidence that there is substance and history behind what you're presenting as your belief, that it's a practice that you've had for years. We have to have people participate in the exemption process to explain to us and define for us that it truly is a religious belief that's sincerely held. So there's a lot of documentation and information, and if people aren't comfortable following through and providing all of that very personal information, then that puts us on us to not accept it. The other really important thing, and Dick touched on this as well, is we have to make sure that this is a really documented process and we're offering it the same and interpreting it the same for everybody at all levels of the organization.
Thanks, Laura. We have 3 more questions. I think this one about exemptions was particularly important that we address it from what both Dick said and what Laura said. And I want to take one more question for Monda and Dick. Can you please clarify the percentage of the vaccine measurements? For example, if there's 50 staff and 5 have approved exemptions and the rest of them are fully vaccinated. In fact, Laura and I had the same question this morning. Is this 100% vaccinated or 90% vaccinated?
I'll go ahead and yield to Ms. Shaver on that also.
Sorry, I had to unmute myself.
Okay.
That would be considered 100% vaccinated.
Great. It makes sense to do that.
Yes, it would be 100%. We would expect, it kind of plays into the next question in here too, though, as those unvaccinated or exempted staff, even though they're counted as, compliant, would have to follow any additional policies you have to have them, if they're required to test weekly, if they're required to wear a mask while they work, whatever mitigation standards or requirements you've put in place.
Well, thank you very much, Monda. And I know that we promised NARA, and NARA promises attendees that we'll keep on time. There were 2 more questions in the queue, and I've got the contact information here before I turn it over to our host, Sabrina McCarley. But I do want to say that the PDF, the way that I saved it, apparently the links aren't active. So I'll get those links active back in the PDF handout. And that is where the resources are that Dick mentioned. There's a resource slide in there. So Sabrina, it's your turn.
Thank you so much, Nancy. And thank you, Laura and Dick and Monda. This was a great presentation filled with a lot of information. And I think you're spot on that people are trying to process it. As a reminder, we did record today's webinar and the recording will be available by end of day on Monday. Everyone's going to receive an email directly from Zoom with the link in it. So we wanted to clarify that. We know that if there are any questions, you have everyone's contact information. Nancy did also mention that she took some specific contact information, but please feel free to reach out to Christy as well. Any questions that you think of as you're reviewing all of the great information from today. And Christy does a great job of getting in contact with Nancy and the others to get your questions answered. So thank you everybody for attending today, and thank you to our presenters, and have a great Friday. Bye-bye.
Bye all.